Hey everybody, so something that comes up over and over and over again when working with patients in the regenerative injection space and chronic pain is this idea and concept of treating all of the known pain generators in an area in order to improve our outcomes. And so I had a patient today that we did a procedure on. She was having unilateral low back pain, so it was on one side. And because of the severity of her low back pain, our physical exam was actually a little convoluted. And so what can sometimes happen is when we have an extreme amount of pain, if we're in kind of more of an acute flare or something like that, it can actually kind of blur the lines between the different orthopedic testing. Things that are, predominantly a facet joint test, but mildly a sacroiliac joint test, all of a sudden now becomes if, the sacroiliac joint pain is really, really strong and huge, it kind of blurs the lines and it almost makes like the facet joint test look positive. And so it's really important from a testing standpoint to understand this. But that's really important when it comes to understanding what structures we're going to treat, right? Because we want to make sure that we're not missing something just because we think this blurring of the lines is happening. And so the case that I had today, again, unilateral low back pain. The physical exam showed several different things. One, it showed a strong facet joint component to it. And so a lot of difficulty laying on her stomach, a lot of difficulty turning and looking over that same shoulder, which are classic facet joint signs. But interestingly, normally with facet joint pain gets better when you flex or lean forward, whereas her pain also got worse with leaning forward. So on that side of the equation, it's like, okay, is there a ligamentous issue that's going on, right? Because if the joint capsule around the facet joint is inflamed and causing pain, then flexion can make that worse. If the intertransversi ligaments, which are basically the ligaments that attach between each transverse process on either side of the back, if those are inflamed, bending forward can cause issues there, or laterally rotating away from that side can cause issues because it's basically gapping those two transverse processes. And so we had some of that stuff going on with facets. Some of her SI joint testing was positive. It only was 2 out of 5 out of the SI cluster I do, which puts out about 67 to 69% sensitivity and specificity for SI joint testing. But it was definitely tender to palpation along that area. So that kind of adds in like, oh, maybe there is some SI joint stuff going on as well. But then the other interesting layer to this is that she had a lot of pain and weakness in her back when she would cough or sneeze, which is very characteristic of a herniation that's impinging on one of the nerve roots. Now, normally with a herniation that's impinging on one of the nerve roots, with a cough or a sneeze, pain will generally go down one leg. It generally doesn't stay in the low back. And actually, she didn't have a ton of pain in the low back. It was more so that the sneezing and coughing just caused her back to give out. And so on that side of the equation, it kind of makes me think, well, maybe there is a more centralized issue going on, more nerve root or the cauda equina, which is the distal aspect of the spinal cord. And so we've kind of got all these moving parts. Then obviously we got overlying neurogenic inflammation, which is just present just based on palpation. So we kind of got like all this stuff that's just like, well, there's maybe some stuff here, maybe some stuff here. And so what I do with my patients is we approach and we treat all of those things, because I would hate to go and have the hubris to go, I think it's just facet. I don't think it's your SI. And so let's not treat SI and let's just treat facet. Because what if I'm wrong? If I'm wrong, then the patient's only going to get minimal results, maybe moderate results. They could have no results because I completed treated the completely wrong thing. What we did in this case was we treated the facet joints. We treated the intertransversi ligaments and muscles that are attaching onto the TPs. We did a caudal epidural. We treated the supporting ligaments around the SI joint and the SI joint itself. And what I found during the procedure was that almost every single one of those things recreated some aspect of her pain that radiated down into her leg. When I did a caudal epidural, that caused the groin pain that she would normally have. When I treated the SI joint, that caused some of the buttock pain that she normally has. And when I treated the facet joints and the intertransversi ligaments, that recreated the pain that she gets all the way down into her lower leg and foot. That is huge, because if we had just treated one of those or two of those, basically if we didn't treat all four of those things, then we could have missed out on a huge aspect of her chronic pain. And that's obviously not something that we ever, desire. Now, sometimes we don't know something's a pain generator and it comes out later, because once we treat some things, other things now present themselves a little bit differently, and that can happen, right? But that's a situation where we don't know that that's going to happen, and then we treat and all of a sudden this happens. But in situations like this, recreating her pain during the procedure was really critical for helping us to understand that, yes, all of these structures were contributing to parts of your pain, not all of it. It's not like when we treated the facet joint, it recreated all of her pain. It recreated a portion. And then the SI recreated another portion. Doing the caudal epidural recreated a different portion. And so all of those things meshed together are what created her back pain that she's having on a daily basis. So I hope this kind of gives you some insight, whether you're a practitioner, a provider, or you're a patient, on just how we should be approaching these chronic pain conditions. That it's not just, oh, you have one thing wrong and that's it, right? One tissue pain generator. It can be multiple things that feed into the perception of pain in different areas. All right, everybody. Hope you have a good one.